Hi everybody, welcome back to OrthoNugs. In this video, we're going to discuss the osteokinematics as well as the arthrokinematics of the glenohumeral joint. So I have my model here. Here is my right scapula as well as my humerus. So I think a good place to start, and I tell our students this, is when you're working on naming the arthrokinematic glides associated with various osteokinematic motions, let's talk about the plane of motion and the axis of rotation. So if we start with flexion and extension, the plane of motion is going to be the sagittal plane. The axis is this medial to lateral, or we can call it a coronal axis, that the humeral head will spin around. That axis cuts through the humeral head, the articular surface on the humeral head, as well as the articular surface on the glenoid fossa. So it's a good general rule of thumb that we can follow as we walk through different arthrokinematic glides in different regions of the body, is when that axis cuts through both articular surfaces on either side of the joint, then it's going to be a pivot glide. So when we move into flexion, and when we describe these pivot glides, we usually pick an arbitrary point. I say arbitrary, but as long as we keep it consistent, then each of us will be speaking the same language, so to speak. So we typically pick a superior or lateral point on the moving bone, so to speak, that we will use to describe the motion. So in this case, we're going to use the superior aspect of the humeral head. So as I move into flexion, that's going to be a posterior pivot glide. When I move into extension, that will be an anterior pivot glide. Now if we move to the frontal plane or coronal plane, and I know this is more of an oblique motion based on the orientation of the scapula, but we'll just call this a frontal plane or coronal plane movement. That would be abduction and adduction. So first we can ask ourselves, where is the axis? Well, the axis in this case is more of an anterior to posterior axis. So I won't keep repeating this, but it does not cut through both articular surfaces. So this is going to be more of your common glide and roll type of arthrokinematic movement. So as we move into abduction, we're also going to tap into our convex and concave rules. So we're moving a convex humeral head on the concave glenoid fossa. So we're going to get a superior roll and an inferior glide, and you can see the inferior gliding of the humeral head within the glenoid. And then with a deduction, we're going to get an inferior roll and a superior glide. How about internal and external rotation with the arm at the side? So this is going to be a transverse or horizontal plane motion. The axis will be a vertical axis or a superior to inferior axis. So when we internally rotate, that's going to be an anterior roll and a posterior glide. When we externally rotate, that will be a posterior roll and an anterior glide. Let's see, how about horizontal ab and adduction? So now we're moving in this horizontal plane. The axis of rotation will be somewhere up here. Again, that vertical superior to inferior axis. It is again convex on concave. So as we roll anteriorly with horizontal adduction, we're going to get a posterior glide. As we roll posteriorly with horizontal abduction, we will get an anterior glide. The last one I want to mention is internal and external rotation at 90 degrees of abduction. So this will be more of a sagittal plane rotation. The axis, it's hard to hold these and also manipulate the model here, but the axis is almost going to go through the long axis of the humerus. Back to that rule of if the axis goes through both articular surfaces, and in this case, it will go through the humeral head as well as the articular surface of the glenoid. If the axis goes through both articular surfaces, then it becomes a pivot glide. So let's again pick that superior aspect on the proximal humerus, superior landmark on the proximal humerus, And as we externally rotate at 90 degrees of abduction, that's a posterior pivot glide. As we internally or medially rotate at 90 degrees abduction, that becomes an anterior pivot glide.